Hi, everyone, and welcome to the Ask Why Medicine podcast, where we ask the hard questions so you don't have to. And today I am thrilled to be joined by my friend and an excellent doctor, Dr. Jackie Kilraine. Jackie, thank you so much for being here with me
Great to
today.
be here, Gina. So great.
Uh,
Thanks for having me.
yes, you're welcome. I'm so glad we were able to make it happen and get
Right,
together.
right.
Yeah. So I want to tell you just a little bit about Dr. Kilraine. One is her journey as a doctor, like most of us, continues to evolve. And her work recently, I have got to bring to my patients. She is changing lives every day, and I love her focus. I love her treatments, and I love the lives that are being changed and the stories that are coming out of that. She and I were able to spend a little bit of time together lately at a conference that we were both at, and so it was great to catch up. And wow, you have really got a lot of great stuff going on. And so I'm
Oh,
thrilled that
thanks.
you're able to bring that to my audience and that we're going to bring it to my patients and to myself as well so that we can all have healthier brains and be healthier mentally. And this is such an on-point topic. Not only mental health has always, unfortunately, been a thing, but then mental health and now the impact of our brain and brain health, keeping our mind sharp as well as emotionally happy and joyful and every day being the bliss of life. So anyway, I know that your work has involved a lot through the years, and now that's your main focus. So just start where you want to start and tell us how you evolved from brick and mortar uh, to, and a lot of hands-on. And now your work is a little bit different and you're traveling all over the country. I just want everyone to know about you. And we also want you to make sure you tell us about your story, your personal story, which is
Definitely.
so interesting.
Thank
And
you.
your current, you've lived through a hurricane or two and all of that impact and how that's changed your life as well. So you have so much to share with us. I'm just going to kick it
Oh,
to you and ask you to
beautiful.
tell us about you and about your practice and about how you can help us all.
Okay, beautiful. Thank you, Gina. Yes, so I have been a chiropractor. That's my doctorate is in chiropractic, and I was a chiropractor for 37 years. I was just sitting here trying to add up how long. I was like, oh my gosh, I don't know if I could say that. But anyway, 37 years, and I started doing brain work. This is like what people like you and me do. Listening to a podcast late at night, it was on chronic pain. It was actually on fibromyalgia. I heard an anesthesiologist say, we have to turn down the volume of the pain in the brain. And I was like, oh my God, that's it. Because my focus was chronic pain, was fibromyalgia, were those people that just didn't get better with an adjustment. And I couldn't understand why, and I couldn't figure it out. And, I think there's no coincidences in life. I walked into my office, I was thumbing through a periodical, thinking about that, what he said, and there was an ad for neurofeedback. And the owner of the company I knew really well. I took a year-long course from him. I knew how thorough he was, how much he researched things. So I called him up on the phone. I said, what is this? I need it. And I went and got certified in it, and I brought it into my practice. And I did it on me first. I didn't have any chronic pain. I didn't have any pain at all, but everything, that we do before we do it on our patients, we do it on ourselves. But
Mhm.
I was honestly at that point having a nervous breakdown. My husband had died the year before. And that year anniversary, it just seemed like it was a perfect storm. I was so anxious. I was so depressed. I felt just discombobulated. Like I started referring a lot of my patients out. I mean, I've been in practice a long time. And people that are coming into a chiropractor aren't like having a heart attack. They're not like people that you're going to deal with. But I still was at my wits end for how much I could take in. But when I started doing the neurofeedback on myself, it literally saved my life. I was going to move to California, take two of my kids out of middle school, leave my oldest son in college by himself, who had just lost his dad too, and move to California where my brother lives because we were real close. And one of my friends said, why don't you just move out to where your brother is? I said, yeah, that's what I'm going to do. I'm going to do all that, take my kids out, leave my one son here. I don't have a California license, so I could practice out there. My brother also lived in a monastery. I mean, it's not like I could just go over anytime. So fortunately, I didn't do that, but that was my fight or flight escape thing. So I started doing this on my brain, and it changed everything about my life. I mean, I looked at everything differently. I wasn't anxious anymore. I wasn't depressed anymore. I didn't overthink everything. I didn't talk myself out of everything. I thought I talked myself out of things because I'm a doctor, and you think through every scenario and you all this. No, you might do that with patients for their benefit, but when you're doing it in your personal life, it's really fear. So what I really do is I help make people move, women especially, move from their mind being their greatest enemy to their greatest ally. Because what we're really doing is all that trauma, all that past trauma, whether it's a hurricane, whether it's a death, whether it's moving, whether it's a divorce, all these things that are just childhood things that your brain never forgets. So your brain always wants to keep you safe. So it's going to go down this right frontal pathway that makes you more anxious, makes you overthink, makes you talk yourself out of things. You think being OCD is you're just, it's just how you are. You have to be in control. You have all those things. It's exhausting. You don't sleep. And another thing, when I started doing this on my patients, I was doing it for fibromyalgia. I was learning as I was doing it. So I started this about 15 years ago. And I said, how's your pain? Well, they'll be like, well, it's better, but I'm not anxious anymore. I'm not depressed anymore. And I'd be like, we're anxious and depressed. I flipped through their chart and I'm like, well, there it is. But I wasn't treating that. I was just trying to help their widespread chronic pain that didn't go away. But it was all controlled by that overthinking, anxious brain. And when we corrected the dysregulated brainwave patterns, all those other things just went away. So I mean, for me, it was like I looked at everything in my life pre and post train in my brain. I experienced everything differently. It's just life changing. So I finally had to walk away from my brick and mortar practice after 30 some years because people still wanted to. They knew they really needed to do this, but they wanted to do things their insurance covered, like get a massage, get an adjustment. Those were all nice holistic band-aids for the problems they were having. When they retrained their brain, things they'd had for years and years and years went away, just went away. I mean, there's a brain corrected. It never comes back. I mean, once your brain gets it, it gets it. Unless you have more trauma that kind of throws you out of sync, and then we just do a little more training. So yeah, now I just go all over doing that, which is nice.
Wow. How
Yeah.
exciting. You have to
Yes.
retrain the brain. I love
Yeah,
it.
right. Get it out of those old habits that it's been in. And I first started with, when I first started training people, women who'd been in chronic pain forever. Most of them had at least 2 autoimmune diseases because when your brain is actually running very fast, it activates the immune pathways. And when they're chronically activated, you get autoimmune disease. So a lot of them had MS or rheumatoid, just lots of things, fibromyalgia. So I would just tell them to imagine feeling really well. Well, they had such a hard time even knowing what a good day was that we had to start working on. We had gratitude in the morning because gratitude changes your brain, takes you out of this right overthinking, fearful pathway and puts you in this left prefrontal cortex pathway that makes you calmer, sees the good even in the bad, so you're much more resilient instead of just being down this fight or flight pathway. Gratitude in the morning helps to do that. And then having them imagine their perfect day before they went to bed. You convert short-term memory to long-term memory while you sleep. So just a little imagination before you sleep let your brain start to look for those things, because what happens when you imagine where you really want to be. So if we're going to take away this chronic pain and this anxiety and this old way, now you get to decide how you really want your life to be. And when you imagine something, your brain it goes to an area in your brain called the default mode network. And that looks at it and says 2 things. It says, is this okay? And how do I get it? So first it wants to be sure you're going to be safe. And if it says it's okay, if that's okay, it goes to a certain area of your brain. And then when it says, how do I get it? Then your brain and all the areas that are involved in you achieving that start to pay attention. And that's when you start to see, when you get the purple car and then everybody's driving a purple car and you thought you had the only purple car, whatever you want is out there, you just don't see it because your brain doesn't allow it. So when we can open up our brain and we get to decide what we want it to pay attention to, what we want it to allow in our life, once we get them out of fight or flight and out of that overthinking, sick, anxious mode, then you can start to create who you're supposed to be, which that's so fun. I mean, that's the best part of all of it. And I see it over and over and over. So it's just, it's a lot of fun. It's a great practice. It's just, we cry when they come in because we just want them to get so far. And then we cry when they're done because it's just so joyful.
Wow.
Mm.
Life-saving work. That is
Yeah.
fantastic. I love this so much.
Yeah.
Wow.
Thank you. I do too. It's a joy to do, and that's why I just do it anywhere and everywhere. I just came back from Texas. I was just in Texas 3 weeks ago. I was in Corpus Christi.
Yes.
And now I'm down here in Florida going to do a map on Friday, and I did one in Georgia. So we
Yes.
just do it everywhere, anywhere.
Wow.
Mhm.
So, the individuals that you were talking about that had this chronic pain, then did that ultimately also help their pain?
Yeah, 100%. Yeah,
That's
because
one of the reasons they could not heal, is this.
yeah, that's why they couldn't have the overthinking the high beta brain. So you have different brain waves. You have delta, theta, alpha, and beta. So beta is really important for learning something new, paying attention, focusing intently. But it also, when it gets in a dysregulated pattern, it can make you anxious, OCD, insomnia, chronic pain. So what it's doing when that talk I was listening to said we have to turn down the volume of the pain in the brain, there's a little area in your brain, in your limbic system, and your amygdala that puts you on that hyper state of alert. And a
Mm.
little bit of pain, I mean, pain is something that means you're under attack. So when you have pain and when you have chronic pain, your brain turns up the volume. So instead of most people that might feel it as a 2, you feel it like a 10. And someone that comes up and hugs someone that's got chronic pain or fibromyalgia, and they're like, oh, that hurt. And they're like, that hurt. It hurts because their brain has the volume turned way, way up. So when we correct that dysregulated brainwave pattern, that high beta pattern that puts you on a state of alert, the pain just turns down. You're not running for your life anymore. You don't have to feel it intensely because chronic pain serves no physiological purpose at all. So it's only making you just more hyper aware. And it's a dysregulation. So I couldn't believe it, but it made so much sense to me because as a hands-on practitioner, we were doing trigger point work and we were doing very light work, and I had 3 massage therapists because that's mostly all we treated was women in chronic pain. We had some modalities that no one else in our area had, but once they get a little better, honestly, I think they stayed with me because they knew I was trying really hard. you know but when we started doing the brain, it was like people I treated for 10 years were better, and in 6 weeks they were done, didn't have to
Wow.
come back.
Wow.
Yeah, it's just fun.
There's so much I want to ask you, but one is I wanted to go back to something you said in the beginning that people were getting these, I forget exactly what you called it, but like holistic treatments that were
Yeah,
good, but wouldn't
yeah,
take you all the way there, such as massage and I guess soft tissue
right.
work,
Yes,
manipulations, things like that.
right.
But their insurance would pay for it. And
Their
so
insurance will pay for it. Yes.
both run into
Mhm.
this a lot. And I tell people that to truly save your life from a heart attack or stroke, or to prevent one, whether it's your first one or you've already had one, and to prevent a future one, unfortunately, there are no insurance codes for that. Insurance does
No.
not pay for that. As sad as it is, um,
Yes.
the life-saving work, like what you're doing, it's
Right.
just out of pocket.
It doesn't. I know. And I'm sure we could have a whole nother podcast on how insurance just keeps you sick and how,
Yes.
it's just a funnel for the who know, who.
Right.
So
Hmm.
sadly, that's honestly why I had to walk away, because I could have kept
Yes.
doing that and they would have kept coming. I've been in that was my hometown. I grew up there. I mean, I knew everybody in town.
Yeah.
But I just, in my heart, I couldn't do it any. I couldn't say
Right.
I can't keep giving you this service and then begging you to do what I know would get you well. Go, there's 20 other chiropractors in town. Just pick one of them. But
Yes,
yeah,
yes. Oh, that so resonates with me. And I know we've got colleagues that feel the same way. Once you
yeah,
see there is a better answer out there, it's so unfulfilling to just be on this
yeah.
treadmill of,
No,
the cycle of insurance
yeah,
type work,
yeah,
if you will, and
yeah,
that is not
yeah.
the long-term solution. Sometimes not even a
Mhm.
short-term solution, it's like
No,
a
that's
Band-Aid.
right.
Yeah.
Right, exactly. And and then I know we all got into practice to help people. And when you know
Yes.
what they truly need, you can't do anything else.
Yes. Yes.
So,
And imagine how much time and money outside of insurance all of those people spent seeing you for 10 or 15 years.
oh, I know.
And then you finally had the answer. I mean, me too. It took me
Yeah,
years
yeah,
and years to actually
yeah,
see
yeah.
is the answer. This, throwing out medicines and doing procedures is just not helping anybody long term. I mean,
No,
might save your life
no,
in the moment,
no.
and then,
Right. Yeah,
there'll be more
yeah,
problems.
yeah,
Yeah.
exactly. Yeah.
So talk to me about that a little bit. Like, once you saw, okay, they took time off work to come in and see me. I mean, it costs money, even though your
Yeah,
insurance is covering it, and it's a perpetuating problem. But then when
right.
they got free from it, do they call you if they need you, or do you need to check in once a
Yeah.
month, or?
Follow up. I mean, we check in like now we see people 6 months after they're done. We go ahead when we're done. They give me back the neurofeedback equipment. We schedule a consult for 6 months. Yeah,
Yes.
because you don't know what in life happens. I mean, I had
Yeah.
a hurricane. My dog had a catastrophic spinal cord injury and died. It was all, like in a couple of days. So maybe I needed to tune up a little bit after that, when you kind of get your boat rocked a little bit. But I think about even how I responded to this whole situation, that because we're still not in our house yet, 6 months, 200 and some days later. Um, but I can look at it so differently. I don't go, woe is me. We're living on a boat, um, down at the yacht club, which we've got to meet some beautiful people, just real down to earth, and people that I know will be lifelong friends. A patient of mine that was from Georgia, and she's from Florida, actually, near where I live now. uh, Gave us a 40-foot travel trailer. We lived in this travel trailer in this retired community for like 3 months. That was an adventure. It was fun. I wouldn't have experienced all those things, but I certainly wouldn't have looked at it through the same eyes. I'm ready to get back in my house, but I have had a lot of good experiences that I know before I would have been, I don't know what I would have done. I mean, I used to, when when I'd go to bed at night, even though we all know how important sleep is, I couldn't shut my brain off. So I'd have the TV on to drown off, all the things I was thinking, I should have done this, I need to do that tomorrow, blah, 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 and all this and that, all the things that would go on in my head when you get quiet and lay your head down and you have time just for it to run and you're not busy, busy, busy. I don't have to do that anymore. Now I lay my head down, dark, go to sleep, don't think about sleep great, track my sleep, all that kind of stuff. So it's just different. But I think what we really do is we help women, men too, get back to who they were meant to be before all those layers of trauma get piled on top of you. And you're seeing your eyes through that. You're seeing your life through that. You don't do that anymore. So it's just very freeing. It's like giving your freedom back, really.
Wow.
It's
Wow.
fun.
That is
Mm.
life-saving. That's wonderful. So what
Yeah.
does it look like to work with you? Is it the initial session that you're talking about, and are there several at first, or it's different for everybody, or how does it work?
And we just do one QEEG. So we meet in person. We do a brain map, which you wear a cap on your head, and we measure your brain waves. It takes about 20 minutes. There's 6 minutes with your eyes open, 6 minutes with your eyes closed. It's a little bit longer than that to calibrate, but so that the map is about 30 minutes. And that lets us see where your brain is at. And it also tells us, here's your brain where it's at. Here's where we get it to optimal functioning. And then it's just, I send them home with neurofeedback equipment. And how neurofeedback works is there's a little box, it connects to the laptop, and there's a couple sensors that go on your head. So that brain map that we just did tells us where to put the sensors. So all my clients have to do is put the little sensors with paste, put little ear clips on like little earrings, and they watch Netflix, and their brain is controlling how well they see it, how well they hear it, because when your brain's in that real dysregulated, say that anxious overthinking can't shut off pattern, the screen will get dark and the sound goes down. When it's in the optimal pattern, it will get bright and you can hear it. And your brain figures out how to keep the show on, because it says, I really like the Great British Baking Show. That's what I always used to watch. And so how am I going to watch it? So it's operant conditioning. Your brain gets rewarded for being in a really good pattern. It gets dissuaded for being in a dysregulated pattern. And the more you do it, the more your brain learns. So it's a 6-week training period. We recommend they do it 4, 5, 7 times a week. 5 times is good. I recommend they get 30 sessions in those 6 weeks. So that's 42 days. We want 30 sessions. By then, their brain's usually got it. And we track their subjective findings. So their symptoms, anxious, can't sleep, no motivation, depression, all of those things, chronic pain. And then I say anything that's an 8 out of 10 or above, 8 to 10, I want to track that. I can see when their brain's learning it, consolidating it, left and right hemispheres working together. It all gets consolidated down, brainwaves get in the right order. Their symptom tracker goes just like that. Correlates with it. I love it because it's so objective. I can see when their brain learns, gets it, we can see where it is, and it always corresponds to the subjective tracker too. So, and then once it stays down like that, I know their brain's got it. I can see their brain's got it. They're done. You don't have to do it anymore.
Wow. Oh, exciting. Imagine people come off of some medications that they've tried,
They come off of
tried that
medication.
for years.
I've had some people on 5 medications. I mean, this one lady, I think she said 5 or 7. She was on 7. She took 5 before she even got out of bed. And I had someone come into my office one time who I was treating for an injury, and she just never put any makeup on, which is fine, but she was wearing clothes with holes in them. She cursed all the time. She was just she worked at a convenience store. And then she said, I want to talk to you about that brain thing that you do. When I released her from the injury care, and I said, oh, really? And I remember because the first thing she wrote on her paper was, my hand's shaking as I'm filling out this form. She was in an abusive relationship. She had all this trauma, and she had a master's degree. She's a very smart woman, but she was trying to do all of those other things to keep everything at bay. She got back to work in her degree, in her master's degree. I mean, it was just a beautiful, you just don't know what, and to see that happen in 6 weeks was mind-blowing to me. And that's the kind of thing that just makes you go, I mean, that's the best part. It's not the chronic pain. It's not this or that. It's just seeing people find their joy again, seeing people find their hope again. They look at things differently. I just had someone who thought, her family's mad at her. They don't get along this, that. She'd really get nervous when they had a great time over the weekend, over Easter. They had, they celebrated together, they danced. I'm like, it's everything. That's everything. Yeah, she feels better, but now she's got the joy in her life is back.
Wow.
So that's really why we do the imagination part too. Where do you really want to go? Because now you get to slip in whatever you want. You get to tell your brain, I want to do this. I want to pay more attention to this. And you're like a kid again. To me, it was like I experienced everything with a different mind. I got married, finally let someone in my life, who was an amazing man, but otherwise before I was like, no, you're just too much work. You're too much trouble. I'm going to get hurt, all these things. And then thankfully I put that guard down.
Well, congratulations, by the way. That's really new, correct?
Yeah, November. Yeah, we dated for 2 years. Actually known each other since really elementary school. We grew up a few blocks from each other. So we've known each other for a lifetime. It's really sweet. Yeah, it's good.
That's fantastic.
Yeah,
Wonderful.
good.
Well, so can you do this kind of work remotely, or do we connect personally? We need to be in the same room. Tell me how that works.
Well, we do, I do like to come and see you one time in person. And I like to do the QEEG myself. You don't have to. We can find you another provider who uses the same type
Hmm.
of neurofeedback I do and get your Q done there. Or else I come to you or you come to me and we get the Q done. And then before, this was just done in the office. Like you had to come into the office every time to do it. Now I send you home with the same equipment, things just get smaller, more compact,
Hmm.
and you can take it. If you can travel with a laptop, that's all you really need. So, I mean, I give you the laptop and the equipment. So, and then we stay connected. Like they have my cell phone number. We're always reaching out if they're getting themselves hooked up. The first time you do it, you may have a little glitch here and there, but after, I'm always accessible for that. And then every couple of weeks we get on a Zoom call, check in, see how we're doing. I look at their tracker, their training every day, so I can see if they're stumbling or if something doesn't look right on the training, then we'll connect again. So it's really easy to do at home. It's very convenient. It's much easier for the client to do it at home than they're much more compliant because they can just set it up and do it at 30 minutes before their day starts or at the end of the day or at lunch, whenever. So it's really
Yeah.
easy to do. So I prefer to see them once, but we
Hmm.
don't have to. Sometimes we can find them somewhere else to do it too, but I
Hmm.
still like to do it. Yeah.
Oh, I love it. It's so
Mm.
exciting. I am thrilled for my patients to listen to this podcast and for me to
Oh,
start
great.
talking to them about it. And I can't wait to get my cue and get started
Yes,
with
very
you.
good.
So, and I'll be coming to Florida later this month, so we'll have to see
Oh,
if our
good.
schedule aligns to get started with you then. I know we
I
talked
will
about
make it.
at the conference, and here we are, and
Yeah.
haven't done it yet, but
Yeah.
we'll do it because it's been top of my
Yeah.
list for sure.
Oh, that's
Yeah.
awesome. That'll be great. Oh, you'll love it. Yeah, I know you'll love it. That'll be fun.
Yeah.
I'd love to see you again too. That'd be good.
Oh yeah, I'd love to see you
Mhm.
too. So tell me, how can people that are listening to this podcast, whether my patient or not, how can they find you, get a hold of you, get in
Mhm.
touch with you in order to learn more about what you're doing and sign up with you to get their volume
Yeah.
in their brain? Tell me again, the pain, the volume of the pain in the brain. We got to
Right.
get it down.
Yeah, for sure, right? Make their mind their biggest ally. My
Yeah.
website is My Divine Life. So My
Okay.
Divine Life. Yeah, that's my website. And
I
I
love it.
tried to get out of the pain part of it because that's the best part is really kind of rediscovering. So on there, you can click to schedule a chat with me, a free chat. So there, I'm really available for that to kind of explain what it's all about. And there's a good bit of information on what I do and neurofeedback and all that on there. So it's a good site, My Divine Life.
Okay. Super.
Yeah,
So go to mydivinelife.com, sign up to meet
that's
with you,
right.
and then
Yes.
move forward. Dr. Jackie
Yeah.
Kilraine Price. Did I say that right?
Price, that's right. Yes, you did. You'll
Yeah.
love to hear that.
Oh, just I'm so thrilled for you. I know you're so happy, and your children are happy, and his are, and it's just it sounds like
Right.
it's
Yeah, it's great.
your
It's good.
divine
It's
life.
all really good. That's right, exactly.
Yeah.
Everything I had written down before is here now, so that's a nice thing. That's a good thing.
Yes. Oh, wonderful. Well, towards the end of the podcast, I'd like to give our listeners like a question. And what comes to mind for me, and you can tell me what comes to mind for you, is I have so many patients come to me and say, how can I get off these? I'm on a med to go to sleep, a med to wake up, a med to concentrate, a med for my anxiety, a med for my depression.
Ah,
It's like you're talking about all these
yes,
different meds, and a
exactly.
lot of times they work against each other.
Yeah,
And
they
so
do.
one of the things that comes to mind for me is if you're asking, why am I on all these meds and are they really working? Take the next step and say, is there a better way? Is
Yeah,
there
for sure.
anything else besides medications or in conjunction with the medications? We're not here to tell you today to stop everything by
Mhm.
any means, but just search out what else is out there. That's how you and I got out of
That's,
conventional practice
oh,
with
that's
something
right.
that's much more fulfilling is by saying, this doesn't really seem to be working well as I
Right,
thought it would, or people
right.
keep coming back for me it was for more cardiovascular trouble, another heart attack. Oh, now they need bypass surgery. We knew once they had that first problem, just using medications and procedures and our standard treatment, it was a
Mm.
lifelong thing, impacting their quality of life,
Yeah,
probably the length of their life. And I know you
right.
experience the same thing of, I'm not able to get rid of this pain. We just make two steps forward, three steps back. What else is out there? And
Right, I know, and
um,
that I would see that all the time. Of course, they're taking multiple things for anxiety and stuff for sleep, and then things to wake them up. And we start them on their training, and then I tell them to work with your provider to get
mhm,
them to wean you down off the medication when you start feeling better. And most of them do. We never try to just tell anyone not to take it, of course, but
yeah.
they want to get off of it. And I'll say, "Yeah, here, work with your provider and get off." And people that are in therapy, and I would have a lot of psychologists and psychiatrists who would refer clients to me that were under care for in therapy, because we clear that path. You can get through so much if your brain is not, in the way, basically, of trying to
Mm,
heal some of these other things. So
yeah.
it's so effective, and it all works together, and it all work. Our whole system, as you know, all
Mm,
works together. Your brain is not separate from your body. It's the master controller of your body. So
yes.
anything that's going on up here, and you think if you've got that anxious, overthinking brain, you're shutting down that parasympathetic rest and digest. You can't get into that. And you can
Yeah.
take all the supplements you want, you can do all the things you want, but if your brain is still running for its life and thinks it's going to die in 30 minutes, you don't need to digest food. You
Mm,
don't need to heal, you don't need to do a lot of things. So um,
mm.
changing that changes a lot of health things for sure.
Wow.
Yeah.
So exciting. With all that we've gone through in the last several years, just in the world, a
Hmm.
lot of people are looking for help in terms of mental
Yeah.
health and, getting back to some sort of normalcy and joy in life,
Right.
that kind of thing. But this also makes me think of individuals who struggle to be as successful as they want to be. Perhaps they're incredibly genius, but because of self-sabotage or because of just going in a circle or maybe some ADHD, if you like that term,
Yeah.
some term of,
Sure.
like scattered, but
Yeah.
yet
Right.
sometimes very focused on that perhaps spectrum, although I hate to really give anything a diagnosis, but
Right. Right.
struggle getting where they
Right.
want to be. It sounds like it's a great solution for them too, even if they,
It is. I did a whole thing on your brain in business, because if you could be someone who can't receive, you aren't good at receiving, asking for money, getting paid your worth. There's that. There's people that are really anxious that don't want to pick up the phone and talk to somebody. If you want to be a salesperson, or if you have people on your staff who aren't going to call that person up and check in on whatever that is. Of course, we're our own worst enemy in those things, but we don't even realize that those things can be so easily cleared away. And
mm,
and the brain map always reflects. There's a certain place that a true attention deficit brain what that looks like. Then there's another one that's anxious, that can't focus because they're too busy worried about what they should have done or what they need to do, that they don't even hear what you're saying to them in that moment. Tom Brady does neurofeedback. All the Atlanta Braves pitchers do neurofeedback. I mean, if you want to be in the zone and not think about the last guy that hit the home run off of you or the interception you just threw, you do neurofeedback. There was
mm.
a middle reliever for the Atlanta Braves who said his career would have been over because his anxiety was so bad until he did neurofeedback. It doesn't have to be something that you have a mental issue. If you really want to just sharpen, if I have to go give a big talk, or I've got something really I need to do, I'll do a few sessions on myself just to get my brain in the zone. If you want to be in the
Mm.
zone where you're just works nothing, you're just flying through it, there's a way to create that with training your brain. So it makes it easy.
Oh, that's exciting. I love that so much. Give you the edge, the competitive edge.
Yes, 100%, right?
I like it. In your zone, as you say. That's so cool.
Yeah.
Wow.
Mhm.
You are doing
Mhm.
great work, and I'm so thrilled we were able to get together and for me to learn more
Me
about it,
too.
listeners to learn more about you and about this opportunity. I can't wait to get my sessions. I'll report back to everybody so they can
Yeah,
see
yeah, that'd be great.
changes
We'll
in me.
record it for you.
That'd be great. Yeah.
Awesome. Thank you,
Thank,
Gina. Thank you,
yeah.
doctor. Nice to be here.
Thank you
Mhm.
so much for doing this with me and for sharing your genius with the world. You're doing great work, as I set
Oh,
it up.
thank
And
you for having me. It's been great.
yeah.
Thank you so much.
You're
Mhm.
welcome. Thank you for being here. Okay, until next time, everyone, remember to keep asking why until you find the very best solution.